anytime you're concerned about gaps in the patent system, gaps in our innovation system that may be causing companies not to invest in stuff, how do you know it's a problem? Because the harm from this is innovation that doesn't get created, doesn't reach the public. You can't see that. It's innovation that doesn't exist, so it's invisible. So I spent a bunch of time trying to find evidence or indirect evidence of this, and it turns out there's a lot. The most convincing evidence, or there's actually two. One of them is that whether it's a company or venture capitalist or and even universities with respect to how they spend their money, when they're looking at potential drug candidates to invest in, they always look at the strength of its patents and the amount of time left on the patents. And in fact, they do it at several different stages in development. They double check and triple check. And when they encounter a problem, when it looks like the patent is weak or isn't strong enough or there's enough time left on it, standard operating procedures to drop it. And that's bad, because these are they're not getting rid of this drug because it's not therapeutically valuable or they think there's some problem with the science of it. They're getting rid of it because they just think they can't make money on it because the patent's too weak. And the most telling evidence happened when I started talking with venture capitalists. So these are they're small firms. They invest in small startup biotech companies that have a drug. It's not on the market. It's very early stage frequently, and they're looking for financing and actually sort of support to get it through the FDA process to develop it to get it onto the market. So they're actually now a critical part of the drug development process. And I was talking to them about the different reasons why they pass on drugs. That's why they'll just say, look, we're not going to invest in that particular company. That only, and these companies only have one drug, so that if everyone's passing on and that drug goes away, we just never see it. And I was told the exact language was all the time. They would say, we pass on drugs and companies with a single drug all the time because of a problem with their patent, because the amount of time left is too little, or takes too long to go to the market, or the patent's too weak, or there's no patent at all. And in fact, they went on to say, most of them would say, it's the second most common reason why they will pass on a drug. Well, the reason why they won't get a particular drug is not that they're the first most common, which is not so bad, is that it looks like the science is weak and they don't think it's going to work out, or the market's too small. But the second most common reason, they said, was just there's some problem with the patent, and that's a very bad sign, because the job of the patent system is to make sure that if something needs a patent in order to get developed, it's there. That's its purpose. It's to encourage innovation. If it doesn't need a patent, we don't want it to have one. But if companies aren't going to invest in this thing, if the invention isn't going to reach the public without a patent, it needs a patent, and we should give it to them. The fact that these companies are frequently passing on drugs, these are getting stalled and not reaching us because of gaps in the patent system, just says the system's failing. The obvious solution to this problem is just to say, look, if these drugs need protection in order for companies to invest in their development, whether it's venture capitalists or firm, or honestly even universities are looking for patents and invest in these sorts of things, or put their money into these sorts of things, they need to expect some period of exclusivity, protection from generics once they reach the market. And the reason being that these companies, they spend very large amounts on clinical trials, it costs a lot of money, takes a lot of time, a lot of resources. Their generic competitors, they don't spend that money, right? The very definition of a generic is you don't have to go through clinical trials, you just get on the market because you're the same as what other people are doing. So these companies expect some period, they need some period of being alone on the market before generics enter to recoup their investments in R&D, otherwise they don't make the investments. The way in which you normally do that is through the patent system, we rely on that. But it doesn't have to be the patent system. It can be through the FDA. And what the FDA can do, because the FDA, not only do they regulate brand name drugs, they also regulate generic drugs. The FDA can say, look, once a brand name drug is approved, a new drug we haven't had before, it gets in the market, we are not going to allow generics on the market for some number of years. And in fact, we actually have a system like that. It just provides it's just a very short period, it's 5 years, it's not very long, and doesn't seem to motivate companies to do anything. So we could change the patent laws, and that would be one way to get at it. A really simple way is just to create periods of data exclusivity or market exclusivity, whatever fancy name you want to call them, so that the FDA won't allow generics onto the market for some sufficient period of time. Changing the patent laws is another possibility. It's just complicated, because how do we have these rules that say, look, you can't patent something that's not new. That's actually a pretty good rule. You don't want to patent things that aren't new. There's this problem with drugs. How exactly do you tweak the law? How do you frame it? Changing the patent laws are very complicated, and actually usually it takes a decade or more to come up with a compromise within different industries and different interest groups and different consumer groups to figure out how the language gets framed. With respect to drugs, we have a very simple and easy fix, and that's just using these data exclusivity periods. You just have to tweak the law a little bit.